Good evening, everyone, and welcome to a fresh episode of ATP Live Monday. Okay, so Ask the Pediatrician Lives Monday is a program where you get to ask any questions that you may have about your children's health issues from a pediatrician's life, and you get your answers immediately live. So, welcome. This program is brought to you by Ask the Pediatricians Foundation. Ask the Pediatricians Foundation is committed to the health and welfare of all children globally. Our goal, our mission is to reduce unnecessary child deaths that are especially preventable. And we do that through health education, information, empowerment of parents and caregivers of our children. We also do community medical outreaches. So I'm Bemi Salaboide, I'm a pediatrician, and I'm going to be the one taking all the questions that you may have today. So if you're watching me live, I want you to invite your friends, invite your neighbors, invite everyone. Share the link, whether you're watching on Instagram, whether you're watching on YouTube, whether you're watching on our Facebook page, Facebook group, whichever platform you're watching from. I want you to share the link, invite friends and family that you know may have some questions to ask the pediatricians to come and join us. And I think I'm also just going to share the links and make sure that everybody can see me, they can hear me. So you can drop your comment, your questions in the comment box or in the question box for those of you on Instagram. And I'm going to say it for those of you on Facebook page or Ask the Pediatricians Facebook group. You can also drop your questions straight onto the video, and I will say them. If you're watching on ATP Family or ATP Still a Mom or any of our other Facebook groups, you will have to click on the video so that you'll be able to get to the page to drop your questions, and we can take it from there. So let me know you are there, and if you are rewatching the recorded session, you can always post your questions on our Ask the Pediatricians Facebook group afterwards, and we will answer them as well. So welcome everyone. I hope you've had a beautiful Monday so far. For those of you who celebrate Valentine's Day, tomorrow is Valentine's Day. And from Ask the Pediatricians Foundation, we wish you happy Valentine's Day. And we want you to remember our children, to show love to our children and to support them, because that is what that is all about. All right. So I'm going to just make sure I share the videos to all the various platform, make sure everybody can see me and they can hear me. But you can start to drop your questions. You can start to drop your comments. Let me know you are there. And let me know that you can see me and you can hear me. Remember, when you are asking questions, to always start with the age of your child. Okay, the age of the child is the most important information that a pediatrician needs to know. And if you want to ask questions about the weights and things like that, remember to tell us what the current, what the birth weight of the baby is, what the current weight is, so that we will have the context to be able to advise you. All right, remember not to tell us the whole life history of the child. Just go straight to the point and let us only provide information that is relevant to the parts of the question you are asking, and try and keep it short and simple so that we can see it. If your post is already too long, Facebook will cut it off and we won't be able to see the rest of it. So just keep it short and simple, straightforward to the question, not too much of going around the corners. Right? I guess you know what I mean. All right, so I think I'll share the video now. I'm just going to check that they are pinned to the featured section so everybody can see it and they can hear it. I can see it on my... Okay, yeah, I can see it now. So start dropping your questions and let's know that you're there. Just a few more minutes and then we can start. I'm just making sure that the The videos are pinned. So welcome everyone. All right. And I think one more group to go and that will be good. So welcome. If you are just joining us, you are on Ask the Pediatricians Live Monday program. This is a program where you can ask any questions that you have about the health of your children and get immediate answer from the pediatrician. So I can't see any comments, any questions yet. So I believe some people are not yet online. All right. So you are free to ask any questions you have about the health of your children. So try and ask your questions, and we have just 1 hour to answer your questions. So try and let's do it on time. Okay, I think I can see a question now. If a few seconds to share, because I don't think people on Facebook are saying they don't know what's going on, but I just want to be sure I help them, because a lot of people will now come after the program to say, oh, I didn't know, I didn't see the live videos. So I'm just trying to make sure everybody can say that. All right. Okay, so we'll start taking the question now. Okay, I think I've had Facebook people enough, so hopefully. So if you're on Facebook and you can see, you can hear me, just let me know in the comment section so that I can answer your questions. Please drop your questions in the comments. Okay, thank you. I can see somebody dropping, so I know they can see me now. All right, so we're going to start from Instagram. The first question I have here is from Ise Good Luck. Say, my baby's boo, do you mean poo? We discovered the food it eats. So, like it said, it's like you didn't hear my comments at the beginning. Okay, let's just start all over again so that people can hear. When you want to ask any questions, start with the age of the child. Okay, you need to start with the age of the child. I really need to know what category uh, of our constituency that I'm dealing with. Okay, so every question you must start with the age of your child. You need to give us the context so that we know what we're dealing with. So there are some things that may not make a difference in a particular age group, but in a particular age group, it's a big deal. So that is why, because pediatricians respond to children between 0 and 18 years, and it's a huge kind of there's a lot of differences in terms of the category of people within that age group, from the newborns to the infants to the preschoolers to the toddlers, to the preschoolers, to the school age children, to the teenagers, different issues. So whenever you want to ask a question, please start with the age of the child, all right? So that we have context. If you want to ask about weight loss, blah, 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 give us the weight, current weight, old weight, so that we have context. It is very important. So for Issa Good Luck, you need to tell us what age is your child. And I think you meant this tool because I guess you were rushing to write. So the writing came out and not right. I hope you're still there. If you're still there, just try to update that information. All right, so let's go on. UD colors. Say my baby is a month and 3 days. Very good that you started with the age of the child. And I guess you meant the umbilical cord is set to fall off. Should I be worried? Best weight is 4.1 kilos. All right, that's very good. Thank you so much. So most babies' cord will fall within a few days, 5 to 7 days. But sometimes some babies sometimes have what we call delayed separation of the cord, it may take a little bit of time to happen normally. I think maybe it's 1 month, so 4 weeks. So sometimes we still give them some time, up to even some babies up to 6 weeks and 8 weeks before it will fall off. So there's nothing to worry about. But the most important thing is to check that there is no infection around the cord, because that's another thing that can make it that can cause delayed separation of the cord. So how are you caring for the cord? How are you cleaning it? So there are two methods. I noticed a lot of Nigerian mothers, since we started talking about how to do the cord care, a lot of people actually mix the two methods. You are not supposed to mix the two methods. You are supposed to pick one of the methods. Okay. So the method we recommend as the number one is what we call use of chlorhexidine gel or cloxigel. Chlorhexidine gel is over the counter medication. It's something you can buy. And the advantage of the chlorhexidine gel is that you only need to apply it once a day. All right. So usually when the baby is born, the midwives or the doctors, whoever took the delivery, will apply that chlorhexidine gel right from the hospital. Then when you go home, you're supposed to apply it once a day. So immediately you finish giving your baby the bath and you dry them up, then you can apply the chlorhexidine gel on the cord. Please do not cover the cord with diapers, with bandages. Do not apply anything else. Wash the baby. You can wash the cord area when you're washing the baby, and then dry, and then just apply the chlorhexidine gel. And don't cover it with the diaper. Leave it open. Let the breeze or the hair around the baby blow around it. That is fine. And that's all you need to do. So that is number one method. Number two method is to use methylated spirit, which is what most of us are used to. Now, the issue with methylated spirit is that you have to do it several times throughout the day. And what I normally recommend is that each time you are changing the baby's diaper, we expect you to change your baby's diaper maybe every 3 or 4 hours. Each time it is wet. And you're not supposed to leave the diaper on till night, because the baby has no poo inside. As long as it's wet, you're supposed to change it. Okay. So each time you change diaper, or every 3 or 4 hours, you should clean the cord with methylated spirit. And when most people are cleaning the cord, some people just clean the tip after the plastic, after the cord clamp. No, you're supposed to actually clean more of the base, the part that is closer to the abdomen. That is the real part that you really need to clean, not the cord part, the dried part that is actually beyond the cord clamp. You're supposed to actually clean more of the cord, and you are not hurting the baby, so make sure you clean it properly. We don't want to be seeing yellowish stuff and all those stuff, because those are signs of the fact that it is not properly clean or it is getting infected. So make sure you clean it properly, very well, near the base of the cord. And if you're using methylated spirit, just use your cotton wool and the methylated spirit. Make sure you use the 70% methylated spirit. Okay, there are a lot of fake methylated spirit, there are a lot of methylated spirit that are nothing inside. So make sure you use the real methylated spirit. Buy it in a big pharmacy. Most of them will not stock fake products in those kind of big pharmacies, because they will get it from the manufacturer straight away. So use it. It should be 70% alcohol minimum, and then you can clean it and do it 3 to 4 times a day. So if you are doing that and the cord does not get infected, then it will eventually fall off. So there's really nothing to worry about. Though the most important thing with cord care is the fact that we don't let it get infected, because the umbilicus in a newborn baby is the gateway into the whole body system. The space between that umbilicus and the heart is just very short. Okay, so any infection that goes into that place actually goes to the rest of the body very fast. So that is why we pediatricians are very particular about you making that cord very clean, not allowing it to get infected, so the baby does not develop what we call sepsis and all that. So that is all you need to do for UD colors. I hope that is helpful. All right, let's move on. Ise Good Luck is now back, and she has updated a question. So your baby is 1 year 7 months old. So your baby is passing stool, and you can see some particles of the food that the baby has eaten. In other words, the food come out of the stool undigested. So it's something that can happen in toddlers. Okay, it is nothing to worry about. We call it toddlers diarrhea. So it's is what happens that sometimes there's a what we call rapid transit. When the baby has eaten the food or maybe just swallow the food, they didn't really take time to eat it and digest. So the food just go down rapidly down to the lower part of the gastrointestinal tract, and it can come out um, of the anus mixed with some stool undigested. It's toddler diarrhea. It's something that can happen in them, and it's nothing to worry about. Most of the time, it's just a transient thing. It's something that happens and it will stop. It's not going to go on forever. It doesn't mean there's anything to worry about. What you need to do, just encourage your baby to eat a little bit more slowly and not to rush, and then give them time. But it is something that can happen in toddlers, and you don't have to worry about it. Okay, so I hope that is reassuring for you, Issa. All right, let's just take one more question on Instagram, and then we can go down to Facebook and take a few more questions. So KJ Fabric say my son is 18 months with 3.4 kilogram birth weight. His current weight is 11 kilos. Wow. I guess his penis is not properly circumcised because his penis shape is different from other kids I've seen, and it's getting me worried. Okay. Thank you, KJ. Sometimes, depending on who did the initial circumcision, it is possible, it's difficult for us to see what you are seeing now, but I can understand what you're saying because it does happen sometimes. So, what you really need to do is to take the child to see a pediatrician or a doctor in the hospital, and they will have a look at it. So if the child circumcision was not properly done because they didn't tell us how it was circumcised before, did you do the plastibell method or did you use the traditional surgical method? Where was it done? By a nurse, by a doctor? Those are information that are very important. But you can always go back, and then this time around, I would say go to a doctor preferably, and then they can have a look, and they may want to recircumcise the child. They can do it again. But we also need to be sure the child doesn't have some other issues, because there are some babies that have um, abnormalities around the genital tract. So it could be shape, like there's what we call in other words, the penis is bent somehow, or it could be hypospadias where the opening of the penis is not at the tip, but at the underneath the surface. So there are many things that can go wrong. So most time as parents, you will just see it as it looks different, but you may not be able to put a word to it. So that is why don't just do anything by yourself, or don't just take the child to just anybody to do anything. Please go to the hospital, preferably I will even say see a pediatric surgeon or urologist, because those are the experts in those areas, and then they can have a look. If it's not something to worry about, they will reassure you. If it is something, they will tell you they're going to recircumcise the child. Usually, if we are going to do a recircumcision, they're going to do it under anesthesia, so the child will not feel pain, so you don't need to worry about that. So, but that is what you can do, and it is not too late to do that right now. All right, so I think I will leave that for Instagram, and then I can take a few questions on Facebook. All right, Facebook users. Somebody saying my both corners of my baby's eyes close to the nose, corners of the baby's eye close to the okay, is peeling. Okay, she clocked 3 months. Okay, so when you say peeling, is it that the color is different? Is it just that the child has what look like peeling skin and all that? So this kind of a question, we really need to see the picture. So you may want to, since you're on our Facebook group, take a picture and put it there on our Facebook group, and then we can have a look, and then we can advise you what to do. Sometimes, if it's what I'm thinking, there's some discoloration, so that area looks a little bit what we call hypopigmented. In other words, it looks lighter than the rest of the baby's skin, and sometimes that may be a sign of an infection, like a fungal infection, for example, and that has to be treated with appropriate antifungal cream and all that. But because it's close to the eye, so we really need to be sure. It's not something you can just go and buy any cream and just apply. You have to be sure. So that is why it's better we see a picture. But that is a most likely. And sometimes if it's so small and it's not so bad, we just leave it and allow it to just run its course rather than risk putting unnecessary thing into the baby's eyes, So it depends on how it really looks like. So, but we really need the picture so that we can take it up from there. All right, Facebook user. Okay, another Facebook user. So if you're on our Facebook group and you're posting a question from there, you need to give StreamYard. Right from at the top of that video, you will see how to give StreamYard your permission. If you don't give StreamYard your permission, then I won't be able to see your name. But if you don't mind me not seeing your name, that is also okay. It's okay. But I only see you as Facebook user. The challenge with that is that if you want to give any updates, you have to kind of summarize the first thing you said, because all of you are showing as Facebook users, so I won't know which of the Facebook user you are. So that is the main thing there. But otherwise, it's fine. All right. Somebody say good evening, Ma. Thank you for the good job you're doing so far. My 10-month-old baby is teething, has fever. She's currently on medication. But my major concern is that she has white tongue. I clean her tongue every morning before now. The white thrush makes her not to accept solid anymore, and her gum bleed this morning. How can I handle this now? Now, let me just start by saying that in this question, you've made so many assumptions. I feel like stopping at every sentence and correcting some issue here, and it's very important because this is an health education session. Number one, if your child is having fever, it is not teething, okay? If a child is sick, obviously your child is having fever, your child is sick enough to be on medication, that is not teething. That is a child who is sick. All right, so that's the first thing we need to sort out in that place. So 10-month-old child who is having fever, I guess I want to assume you took this child to the hospital to get the medication and you are not self-medicating. And if it's self-medication, you may need to stop that. The only thing you're allowed to give this child is paracetamol or any of the fever reducing drugs like paracetamol, ibuprofen, but don't do self-medication. That's number one. So if your child is having fever, it is not teething. It is not. That child is sick. The reason why it's so important for us to say this is that a lot of people always say my child is teething when they are sick, and then they don't bring the child to see the doctors. And sometimes by the time they come to us, it's late. And then the pediatrician, the first question we always ask is that they should have been sick for 1, 2, 3, 4, 5 days. Why are you just coming last minute now? And they were like, oh, I just thought it's teething. Because when you think it's teething, you think that is normal, and you think that there's nothing to do. And some of you even go ahead and give teething mixture, which is what you believe is the right medication or treatment for teething. And that's number one, you are delaying us in treating the child appropriately for whatever illness the child has. And for children, we always have a short time to intervene. So the earlier we do it, the better. Two, giving wrong medication. Most of those teething mixtures are not approved. We don't want any child taking teething, so-called teething drugs, because that teething is normal, it's not a disease, doesn't need any drugs. So there should be no teething mixture being given to the children. And when you are giving teething mixture, you have a false assurance that you're already dealing with what is wrong, whereas you are dealing with nothing and you're actually making things worse. So teething is a normal developmental process or the milestone in children. It is not illness, it does not make them sick, and it does not require any treatment. And if a child is having any symptoms, fever, diarrhea, vomiting, rashes, don't assume teething. Take that child to the hospital. Now, your child has a white tongue, but then you use the word thrush. So there are two different things, because it's so important for us to differentiate. Children can have white or white coated tongue because they are taking milk, they are taking pap or things like that. It can make their tongue to be coated white. That is different from oral thrush. In oral thrush, it is not coating. Oral thrush is a disease, it's an illness. It's a child who is having a fungal infection, which we call oral candidiasis. And because the treatment for both is different. So if a child has a white coated tongue, we just need to clean the tongue, usually with a soft cloth, and water. That's all. And all the whitish coating will come out. But if a child has oral thrush, that child needs to be prescribed a medication, oral nystatin or any of the antifungal medication to get rid of it. So we need to know which one your child has. And please don't make assumptions by yourself. So if this child has some whitish coating in the tongue, this is the same child who is having fever. The child is also refusing food. I'm seeing a child who is sick, who is very ill. This is not a child who is having coated tongue. This is not a child who is sitting. This child is sick, okay? Because you have given at least 3 symptoms now that worries me. This child is having fever. This child is having what look like oral thrush. This child is not eating. This child is refusing food. So there are 3 things there that is pointing to a child who is actually ill. The child is also having bleeding gums. So this child is sick. So this is a child that really needs to see a doctor and get properly treated. Because like I said, oral thrush is a fungal infection and its treatment is not just cleaning the tongue. This child has to have antifungal medication. So for this Facebook user, I really want your child to go see a doctor. So you need to be gentle with the cleaning of the mouth. This child is already bleeding gum. Bleeding gum could be if there's some poor oral hygiene, or it could be a sign of like maybe vitamin deficiency, like vitamin C deficiency, or some other illness can also manifest with gum bleeding and all that. So with the fever, with the poor appetite, with the what look like oral thrush and all that, we definitely need to have an overview by a doctor so that the child can be treated. And you told us the child is on medication, but you didn't tell us which medication, you didn't tell us who prescribed the medication, so we don't know whether it's appropriate or not. So, but summary, I think I really want to take this child to see one of my colleagues so that they can get the child treated properly. All right. I hope that's helpful for that person. All right, the next question by Deborah. Good evening. I saw mosquito bite on my baby's forehead, and I noticed it was quite hot yesterday, and I gave him paracetamol. Should I still be worried? Okay, now let's kind of break this down. Mosquito bite is not malaria. Okay, you can have mosquito bites and not have malaria, all right, but that is also not a good thing because mom, we want this child to sleep under long-lasting insecticide-treated nets. So it is our fault if our babies are having mosquito bites because it means we're exposing this child to mosquito. And even though the child may not even have malaria now, but the more mosquito bites the baby, the more chances the child is going to get bitten by a mosquito that has a malaria parasite in its blood, and this child is going to have malaria. And malaria in this age group is serious because they can have what we call severe malaria. In children under 5, they can have severe malaria. So we don't want them to have mosquito bites. We don't want them to have malaria. So please let children stay under the nets, okay, under the malaria long-lasting insecticide-treated nets, number one. And during the evening, when mosquitoes are likely to bite them, wear them long sleeves, onesies, and things like that. So that's number one. If your child is hot, don't rush to give paracetamol. Take a thermometer and measure the temperature. So I expect every mom to have a digital thermometer at home. It's the basic of all things. So when you think your child is feeling hot, don't rush to give paracetamol. Get your digital thermometer, put it in your mouth, put it under the armpit, whatever. Follow the instruction, wait for it to beep and read what is the temperature. So normal temperature is 36.5 to 37.5. That is normal temperature. So if your child's temperature is above 37.5, then that child is actually hot or having fever. And then that is when we can give a bath, or we can just use what we call tepid sponge and put a soft towel in normal temperature water, not hot, not cold, normal temperature tap water, and then use it to dab the body. Or you can even give the paracetamol, no problem. But you must know what is the temperature before you rush to give paracetamol. All right. Okay. So that is what I will recommend. So if your child was bitten by mosquito, but child is fine because I can't see any temperature here that say this child has fever. then the child is active, is playing, the child is okay. So there's no need to worry. There's no need to do anything. Please do not treat malaria because the child has mosquito bites, okay? And do not give children anti-malaria like every 3 months, every month, all those things some people do. Let's stop it in 2023. It's not necessary. If the child is having fever, we can give paracetamol. If the fever persists, then we have to take the child to the hospital, and then the child can be tested for malaria. And if it is positive, that is when we should now treat malaria. So, Deborah, I won't worry about your baby, but please, and let no mosquito bite our baby again. Let's do something about it. Make sure your house is you fleet or you fumigate, you make sure you clear all the rubbish around the house. Let's just reduce the mosquito in the house, and let the baby sleep under a long lasting insecticide treated nets, and where onesies, things that will protect baby against mosquito bites. That is what we want you to do for us. Thank you very much. All right, let's go on. Somebody's asking, what is the best time to stop breastfeeding? I guess you meant the age to stop breastfeeding. Okay, so that is personal. Okay, but we recommend that you breastfeed your baby for at least 2 years. 2 years and beyond. All right. Your baby is 15 months, that's fine. You are still breastfeeding, but people are saying, please don't listen to people, just ignore them. It is between you and us, the professionals. So people see a lot of things, doesn't mean they are right. Most of the time they are ignorance and they are just saying what they don't know. So your baby is not sucking blood. That is nonsense. So when you press your breast, you see blood coming out. All right. Your baby is not sucking any blood. Your baby is sucking breast. And your baby can breastfeed for 2 years and beyond. So don't listen to all those ignorant people around you. Keep breastfeeding your baby. The more you breastfeed, the better for you and your baby. Number one, breast milk still protects your baby against infections. It's good for the brain of your baby. Baby will have a good IQ. It protects you, the mother, from breast cancer. The longer you breastfeed, the more protected you are against breast cancer. That is the truth. So there's absolutely no truth in what these people are telling you. Rather, there are loads and loads of advantages when you breastfeed, and breastfeed very long. WHO say 2 years and beyond. We don't even say don't breastfeed to 3 if you want to. I know people that breastfeed to 3 and 4. I know it's not easy, but the most important thing is that you can breastfeed for as long as you want. And the minimum we even recommend is 2 years. So go ahead and breastfeed. Don't listen to ignorant people. All right. Hi, Dr. Bemi. What is the cause of eye infection? Well, okay. Thank you for the question. Eye infection depends. There are many infections. So when we say infection in medical jargons, we basically mean there is a germ that has gone to the wrong place where it should not be. So in this case, you are talking about the eye. So any germ going into the eyes and multiplying and causing problem, that is eye infection. Now the issue here is that there are many kind of germs. So we have the viruses. So we have the viruses that can cause infection in the eyes. So we usually call it viral conjunctivitis and different kind. We have the bacteria. So we can also have bacterial conjunctivitis and many different kind of bacteria again. We also have even fungal. We have so many kind of germs, as we would like to call it, microorganisms that can cause infection. So you can't. So you say what are the major causes of eye infection? So I've just told you now these germs, but there are like thousands and thousands and millions of them. So which one in particular are you referring to? So it's best to see a doctor. Sometimes we can suspect by the way the symptoms are, what kind of germ may be responsible. But sometimes even we have to take like some what we call culture. We have to take part of the discharge from the eyes or something and send it to the lab, and the lab will tell, oh, it is this particular bacteria, it is this particular germ, and then it will tell us this is a particular drug or antibiotics or whatever that is best for it. So if you think your child has eye infection, please don't do anything without seeing your doctors, okay? Please be careful. Don't put breast milk in the eyes. Don't put sugar in the eyes. Don't do any of those nonsense. Please, those things are very dangerous. Your best thing to do is to go to see a doctor who will prescribe appropriate. And don't just go use any antibiotic eye drop by anybody. You go and just buy cranfenical. Go and, no, don't do that. And there are some eye drop we don't use in a particular age group. So we are very particular about this. And so please, you see the doctors first, and then the doctors will tell you how to manage and how to treat the infection. All right, I'll take one more question on Facebook and then I'll go back to my Instagram people. All right, so is there anything to worry about if a baby is having a big navel? Well, it depends on how big the navel is. So, a big navel usually tells us what we call umbilical hernia. The child has umbilical hernia. That's what it means when you say big navel. It's actually an hernia. Hernia means there's a space in that navel, and some of the things inside the abdomen that should normally have been in the abdomen, they will now start coming out through that hole into the navel, and that's why the navel is big. And that's why when the child coughs, they become bigger because more things, the pressure push more things out. And when the child is lying down, and you can actually use your hand to press it down, everything will go back to where they are. So sometimes the hole will close by itself. Usually by the time they're about 5 years, most of the time the hole closes and the navel should have become smaller. But if it's a very big one and the hole is really big and things are really coming out, the danger there is that we can get to a situation where some things will come out and they can't go back again, and that is what we call obstruction. And then the child can have pain, and sometimes it can be so bad the blood supply to those organs that have come out, or those tissue that came out of the abdomen, they can be compromised and they can start to die, and we have what we call strangulation. And these are emergency conditions, so we don't want that to happen. We don't want obstruction, we don't want strangulation. So sometimes if it's a small hernia, we say let's watch whether the hole will close by itself and it will resolve. So most time we don't do anything. But if it's a big one or there is complication of obstruction or strangulation and all that, we have no choice than to do operation, to do a surgery. So what the surgeons do is to go there, push back all the things that are outside where they should not be, and then close that hole. So we call it aneurysm. So they do a surgery to close the hole so that the navel will not be big and things will not be coming out. And it's not really a big procedure. So if you think the navel is really big, and you're not sure whether whether it's the type that the doctors will just want to watch, or is the type that we want to operate now, it's better to see us, see one of us, see any of the pediatricians or pediatric surgeons. We will have a look and then we can advise you that, okay, this one is a small one. We will watch and see whether it will go down by itself, or this one is a big one, or this one is causing problem. We're going to do surgery now. And so just follow whatever your doctors tell you to do. All right. I think I will pause on Facebook and go back to Instagram so that Instagram people will not be upset with me. All right. It's a good luck. I think I've answered your question. Yeah, I've answered your question. So you're the one that has the undigested food in your baby's stool. That's toddler's diarrhea. There's nothing to worry about. So you do colostrum. Can I switch from the isopropyl alcohol to the gel? I should just continue medicine spray. Just stay with one. Like I said, if you are for cut care, we don't want you to stay with one. So since you're already using methylated spirit, just stay with it. You don't have to change to another one. So just stay with one. It's not going to make it not one is superior to the other. It's more about convenience. So, and usually the gel, we prefer use the gel in the first 7 days. So now that you're on spirit already, your baby is a 1 month old baby, I think you should just maintain with the spirit, but just do it more frequently. So that is that. All right. How do you clean your 1 month old baby's tongue that is coated with milk? Okay, I think I've answered that in passing. Clean clothes and water. So just put any of the face towel. Just know that this particular face towel is for cleaning the tongue of the baby. You just put it in normal water, and then you just clean the tongue. That's all you need to do. Nothing else. Please don't use tomato, don't use glycerin, don't use borax. What else do people use? Don't use any of those things, because normally when I answer questions like this, I always like to also tell you what not to do, because I know my competitors, the experienced mothers, they are going to come and tell you to do all the other things. And most first-time mothers or new moms they get confused by all these big aunties, grannies, and everybody telling you to do 1,001 things. So please don't listen to them. Don't get confused. Just stick to what the pediatrician asks you to do. The way to clean your baby's tongue: face towel and water. That's all. Just clean it. You can do it each time you are having baby's bath, as part of your baby's bath routine. So you just clean the tongue as well. That's all you need to do. You don't need to do any other thing else. All right. Ilagbayeja. Wow, that's what is the difference between fever and malaria? Okay, thank you for that question. All right, let me just start by saying fever means the baby's body temperature is higher than normal. Okay, that's the meaning of fever. Fever is not malaria. All right, a lot of Nigerians, especially, we always assume fever automatically means malaria. In fact, people always say I have malaria fever, or people say I have fever and I'm taking anti-malaria, as if they expect us to just assume that the fact that they say they have fever automatically means they have malaria. No. So fever just means your body temperature is above normal, above 37.5, which is the cutoff for normal body temperature. So that is just the meaning of fever. Malaria rather means you have what we call the malaria parasite, Plasmodium, circulating in your blood, and of course it's an infection. So fever is a symptom or a sign of an illness, but there are like hundreds and thousands of conditions that can make you to have fever. So malaria is one of them. You can have typhoid. It will also give you fever. If you have infection in the eyes, like somebody was just asking me now, infection of the umbilical cord, like somebody was just asking, infection in the urinary tract infection, any organ of the body, in the ears, ear infection, throat infection. It doesn't matter where the infection is, all of them can manifest with fever. So fever is just a sign. It does not tell us the diagnosis. It's not a diagnosis. So everybody having fever does not automatically they have malaria. No, you can have fever without having malaria, because there are other things that can cause fever. And malaria tends to present with fever, but it's also possible to have malaria without even having fever, actually. So, but majority of the time, let's say 99% of the time, you will have fever with malaria. All right. So fever is not malaria. Malaria is not fever. So Nigerians, especially, we need to update our vocabulary, so we don't always think everybody whose body is hot is having malaria. No. And let's stop treating everybody whose body is hot with anti-malaria. People will say, oh, my body is hot, I'm going to go and take anti-malaria. Why is your body hot? You don't know. And then you just want to go and take anti-malaria. That is wrong. So if your body is hot, like I was trying to tell the mom who asks about her body having mosquito bites and the body is hot, you must also check the temperature. Let me just stay with my consistency now with the children. So check the temperature of the children first. If it is high, 37.6, 37.8, 38, 39, give them paracetamol. And the question is, why is the body hot? So that is the question we need to answer. And there are many things that we need to check for. Sometimes it could just be that you are overdressing the baby, especially if the weather is hot. And some of us still believe that the children must wear cap and socks and mittens and sweater, because it's written in Nigerian constitution that babies must be dressed that way. They are going to be hot, and you are the one making them hot since they don't have any malaria. So what you need to do in that case is just for remove all those extra unnecessary layers of the socks, the mittens, the cap. Remove it. let AC blow on them, because some people also believe that it's written in the constitution that newborns should not use AC. So when you do all those things, when you hopefully take away all those wrong system, you may find out that that is all that is causing the fever, and the fever just go. But if the child is also having other symptoms, you've given them a bath, you've given them paracetamol, the fever persists, then the doctors want to know what is causing the fever. And we don't just see the child's face and say, oh, it is malaria. No, like most people that tell you what to do at home. We look at the child, we check the ears, we check the throat, we do all those things. We examine the child. That will help us to know whether we can figure out where the fever is coming from. For example, if we look into the ears, we can see red hair drop, or we can see pus coming out. Then we know it's most likely ear infection, or the eyes is also having discharges. And then we know maybe if we look into the throat is there, it's exudates and all that. Then we know, maybe it's throat infection. Sometimes we do all that, we can't see anything wrong, but the child is having fever. Then we begin to think, okay, can we look for other things that cannot, that we cannot see anything? So we begin to check. We check the blood, we check the urine, we do all those things, looking for where the fever is coming from, looking what is causing this fever, and then that is the only time. So if we do the blood test, we see malaria parasite, oh, it is malaria. Sometimes we do the blood test, there's no malaria, but maybe the white blood cell is so high, then we know there's an infection going on. Then maybe we check the urine, and the urine is starting, oh, there's E. coli here, blah, blah, blah. Oh, okay, it's urinary tract infection. That is how doctors work. That is how we know what is wrong. So we don't just make assumptions. So fever is not malaria. Malaria can present with fever, and fever won't be the only symptoms, but there are like hundreds and thousands other conditions that can also present with fever. Even cancer can present with fever. So there are so many things that can cause fever. So don't make assumptions, see the doctors, and we will take it from there. All right. So I hope, Lal Hagbaye, you've gotten that uh question. Okay, Juliet is complaining that this don't like to sleep under the net. So yeah, there are many ways of using mosquito nets. Okay, you can use the big ones that covers the big bed, and it is not so close to them. You don't have to use the one that the children are so is so micro that they are under, they are obvious they're under the net. So you have to, if your baby has a cut, the big cut, you just drape it over it. They won't even know they're under the net. Of course, so you must let them sleep under the nets, okay? Mosquito bites we don't want, okay? If you don't want to use nets, then you make sure your own rooms, the windows, they are netted. Make sure your house is fumigated. You may have to flee the house, but the challenge with that is that you have to make sure that when the children, when you fumigate or you fleeted, you have to take children out of the house for hours until all the smell, everything is gone. So nothing less than 2 hours before you can bring them back in. So that's the challenge. You can also use even mosquito repellent, especially if you are just going to carry them outside outside, maybe into the balcony or in the garden, and you're going to be there for quite a while. Sometimes you have to put mosquito repellents on them. So you can try all those methods. But the one we recommend as number one is the net. So please, our children should not have mosquito bites. So it's the mother that are responsible for that. All right. Now, Chief Girl say, good evening, ma'am. Please, can I reintroduce breastfeeding to my 10-month-old daughter? Did you stop breastfeeding before? She suddenly stopped sucking. How long ago was that? Because I only breastfeed at night. It's been 2 weeks. So the baby did not stop sucking. You weaned her. I don't know why mothers don't get that. I've said that. I've explained that before. If you're already breastfeeding your baby only at night, you're already weaning the child. That is what you're doing. And so the child just follow the pathway and stop. That's it. So that is how we wean children. When we want to wean, when we want to stop them from breastfeeding, we begin to reduce the breastfeeding. And then when you begin to reduce it after a time, okay, the child also gets it that it's time to stop. So if you've reduced your breastfeeding to only at night, then you have weaned your child yourself. So that is what has happened. So if your breast is still flowing, you can put the child back to the breast. But if you are not planning to wean the child, then you should breastfeed all through. You should not reduce the frequency of breastfeeding. I always like to say that because a lot of mothers get it wrong. Because I see people tell me, my baby stop breastfeeding at 7 months, my baby stop breastfeeding at 8 months. Most of the time, we did this. We stopped breastfeeding those babies. You didn't mean to, But that is what you did eventually, because what normally happens is that once baby start taking the complementary phase, a lot of mothers now feel, okay, fine, should be you are eating other food. I can have a break from breastfeeding. I will breastfeed you only when I have the time or only at night. That is what happened. But what you are doing is winning. It is not until you stop completely that you started to win. Immediately you start to reduce the frequency or the number of times you breastfeed your baby, you have started winning that baby. So it's just a matter of time the baby will stop breastfeeding. That is what has happened. It happens all the time. I get this question all the time, and I'm always very surprised when mothers don't see that's what they're doing, because then they come and ask the baby, "Oh, my baby just stopped breastfeeding by herself," and pushing the fault on the babies. And I'm like, no, it's not my baby's fault. It is you, the mother's fault. So when you start complementary feeding, please keep breastfeeding the same way you were breastfeeding before. Don't reduce it. Complementary feeding is not winning. Complementary feeding means you are still breastfeeding like we were doing before, but you are now adding other food. You are now adding the solids to it. It is addition. It is a complement to the breastfeeding. The food is complement to the breastfeeding. It is not. So a lot of people make. I think I'm going to take that complementary feeding series very soon, and I think I'm going to take it in bits this time around, and not do it in one session. I think I'll do it in bits. A lot of people, when you start complementary feeding, they go for formula. No, there's never anywhere where we thought that when you start complementary feeding, you need to buy formula. You don't need to, because your breast milk is still the milk that the baby needs. What we say you should add are the solid, not formula. So a lot of mothers just go straight to the formula, buy the bottle, start giving formula and bottle feeding the child, and then they will only put the baby to the breast whenever they remember, maybe only at night, or whenever, even sometimes they may not even remember. Then the baby will stop sucking, and hell, baby stop breastfeeding. You win the baby by putting the baby on a bottle feeding, by going to formula. Complementary feeding is not adding formula to your breast milk. Complementary feeding is adding solid to the breast milk. So keep breastfeeding. It is still the milk that the baby needs, and then you now start trying. Is it pap? Is it rice? Is it your potato? Whatever you want to be adding, and you do it gradually. So usually when you start at 6 months, maybe 2 times a day, the majority of that baby's food is still breast milk, and that is what you do. And then you gradually increase the solid, and you keep breastfeeding the same way. It is when you are ready to stop breastfeeding that you begin to reduce the breastfeeding. But once you start reducing breastfeeding, whether you cut it down by 1 or 2, you're already winning your baby. And it's a matter of time that the baby also gets that information that, okay, they don't want me to suck anymore, I'm going to stop. It is a natural thing, okay? But the good news is that if you are still lactating, you can put your baby back to the breast, because like I said earlier on, we want your baby to breastfeed for as long as possible, 2 years minimum. All right. So you can still always go back to breastfeeding your baby. But you should not blame the baby. So it is the mothers that you are the one winning the babies. It's not the baby stop sucking. 99%, let me not say 100%, 99% of the time, when people tell me that, when you ask the question, you'll find out that it is the mother that win the baby. But because they didn't intentionally do it, they will think, oh, the baby just stopped. But you unintentionally started winning your baby, and the baby just get the message, and then they go for the bottle, or they go for the solids, whatever you're giving them, and they don't want the breast milk anymore. And you can't blame the kids. So it is, if you want your baby to keep breastfeeding and you don't reduce your breastfeeding, you keep breastfeeding the same way until when you're ready to stop. Somebody is asking, what can you use to cure geographic tongue? There's no cure. Geographic tongue doesn't need any treatments. So if you are really sure that's the diagnosis, if you have asked on our group, or your doctor has told you it is geographic tongue, then just leave it alone. It doesn't need any treatment at all. All right. I hope I've answered that. All right. Let's take a break from Instagram, and then we'll come back again. All right. Let's quickly go back to Facebook, because our time is up. Oh my goodness. It's up just 6 minutes. I can't believe it. All right. I'll just be very fast now. Okay. I think I've answered the question on Big Novel. Thank you, Mike. You are doing so well educating us. Thank you for your kind words. Please up here. My 18-month-old is well, but her weight doesn't seem to go up as expected. Weight, best weight is 3, current weight is 9. I feed her 5 times a day. With what? Okay, so I always like to know with what. So the weight is not so bad, though we expect the weight to be closer to like 11 kilos for an 18-month-old, but 9 is not too bad. But the question is, when you say your baby is eating well, the question is, what is baby eating? How you've told me 5 times a day, but what exactly goes into that plate? How what quantity goes into that? Those are the questions I want to know. It is me that will decide whether that baby is eating well or not. So the fact that baby eats or something is going through the mouth does not mean the baby is eating well. All right. So, for example, a mother may give baby pap 5 times a day. That is not eating well. No, baby is eating, but baby is not eating well. So we always want to know. So usually, if you come to a pediatrician, the question we're going to ask you first, give us a 24-hour dietary record. Tell us what this baby has eaten in the last 24 hours. I want to have that information because, and then I'm going to be saying how much carbohydrate, how much protein, how much this and that is there. So those are the no what is in that food plate? That is the most important question. Then number two, have you dewormed this baby recently? So your baby is 18 months, so we expect you to have dewormed baby at least twice. So you should have dewormed at age of 1 year and 18 months as well. So deworm the baby. Let me know what exactly goes into that food plate. Or you can go to you're in our Facebook group. So you go to the guide section, go to the guide to complementary feeding, watch those videos, and then look at what you're giving your baby. And there's also an article on the quantity, the amount of calories, the amount of variety that should go into the plate. Check it yourself. Am I doing the right thing by the quantity, the quality? I think your frequency is good. Your frequency is good. It's 3 to 4 times a day of complementary feeds and 2 snacks a day. So 5 to 6 is still good. So, but I just want to know what are the quality of what goes into your plate. Please, we need a lot of protein. We need a lot of fruits, veggies. We need those things there. So it's not just pap, or only cereal. No. So those are the things that we need to know. All right. But the weight is not so bad, but just take note of all those things. 6 months old baby took her for immunization today. She weighs 6.3, birth weight is 3.3, breastfed exclusively. She looks healthy, that only that she's not getting enough weight. Who told you she's not getting enough weight? Okay, your baby was 3.3 at birth. Double birth weight is 6.6. Your baby is already 6.3. That is good. It's okay. It's not having, it's okay. So, yeah, when we say double means averagely. So 6.6, 6.3. It's not too far from each other. It doesn't have to be on the dot. So don't panic about that. So now that your baby is 6 months, don't worry. Go and start complementary feeding now. Your baby is fine. I'm not worried about your baby's weight. Even though you told us your baby birth weight was 3.3, but it's possible your baby may have lost weight at the beginning, before regaining weight and all of that. So a lot of things could have happened, but 6.3 to 6.6, I'm not worried. I'm not going to sweat. I'm not going to sweat that, so don't worry about it. So I know you are a very good follower of ACB, so you know that your baby should double, which is quite good. I love the fact that you know the right thing, but you don't need to sweat every little stuff. So 6.3 to 6.6, nobody's going to worry about it. It may even be the scale error here and there, we won't worry about it. It's big stuff that we're going to worry about. So, but good, I'm happy you did exclusive breastfeeding. You can now start complementary feeding. If you don't know how to go about that, please go to our guide 2 section. Make sure you watch all those videos. Start complementary feeding. Let's see what your baby's weight is in another 1 month. But please don't worry, you are doing well. Yeah, you are doing well. Well done. All right. Somebody said my baby of 14 weeks had immunization. Baby of 14 weeks, but weighing 6.8. The weight is fine. The weight is fine. No worry, no worry. The weight is fine. Chinozo, good evening, dog. God bless you for your selfless service. Amen. My son, daughters, 5 years, 4 months, having rashes. Okay, the rashes are spherical in shape with pores. Okay, on the tip, leaves a round mark on the body. All right, so we need to see these rashes. You said pause. Pause makes me think of something bacterial infection. So, and it's happening to both of your children. So, how are they getting exposed to these germs? So, please make sure you are paying attention to the hygiene. So I'll recommend maybe you put a little bit of Savlon or any of the antiseptic in the bath water, or you use something like antiseptic soap for just like 2 weeks. We're not expecting you to use antiseptic soap forever, but when children already have like bacterial infection on their skin, you can just use for like maybe a couple of weeks, like your tetomazole, sol, and all those kind of things. You can use for a couple of weeks and see whether the rashes will clear. If it's not, then you need to see a doctor. We need to see the rashes, then we can advise you on what to do. All right. Deborah, you're welcome. Juliet say my 7 weeks has cough kata, blah blah blah. They put her on treatment for 3 days. 3 days treatment is malaria treatment. I want to know what is wrong with the poo. Okay, I don't know what is wrong, but I guess the medication they put your baby on could definitely affect your baby's poo. All right. So when you say government hospital, did you go to the health center or did you go to a general hospital or whatever? Because cough and catarrh does not need any drugs, does not require any treatments. Okay. If you've gone to the health center, they may just have put this child on unnecessary anti-malaria, which is what I think has happened here. So of course, when you go on medication, it can affect the baby's stool and all that. So if you have completed the treatments, so just keep breastfeeding your baby exclusively and just see. Hopefully, this too will go back to normal. All right, but just breastfeed. Don't give any other drugs again. Just breastfeed only. No water, no gripe water, no all those things you people are giving. Yeah, jogba. Let's just go and destroy it. Let's just breastfeed this baby only. That's what we need to. And if there are people at home that have cough and catarrh, keep them away from the baby, please. Just breastfeed. Make sure the room is well ventilated. Let's avoid all the smoke, the generator fumes, the kitchen smell, and the cooking and all those things. These are things that irritate the nose and cause all this cough and catarrh. So you need to deal away with them. Just breastfeed this baby only. All right. For the newborn babies, try and avoid taking them to the health center. Take them to at least a hospital with a doctor, preferably general hospital, teaching hospital level, because some people don't know what to do. And when they don't know what to do, they just feel that they have to do something and they must give medication. And of course, in Nigeria, malaria is always for, is the number one treatment for everything. No, it doesn't have to be. All right. Somebody say I have to stop my baby from breastfeeding for almost 6 months. Why? Okay, you stop your baby breastfeeding for 6 months. You didn't tell us why did you stop, and now the baby is coming back to suck the empty breast. I don't know why you stop, because that's what we determine whether it's harmful or not. Are you on medication that they say because you're on this medication don't breastfeed, or what? You didn't tell us. That is the most important information, because there's never, and you didn't tell us the age of the child. So there's so many things missing in that question. So it's difficult to answer. But you can always breastfeed your baby. Your baby can always restart breastfeeding as long as there's nothing with your breast milk that is wrong. So which is what I really need to know. All right. Somebody said my baby of 5 months, tummy makes noise. She struggles to pull. She won't pull unless I put cotton bud. Please don't do that anymore. Don't put cotton bud in our anus. Our poo is normal. Exactly. If the poo is normal, wait for the baby to pull by herself. Stop trying to force her to pull on your own timetable. Babies on breast milk, especially, they may not pull every day, and they may go for even weeks, 2 weeks before they pull. But when they pull, the pull will be normal, which is exactly what you are telling me. So baby is not constipated. Just give them time to do it on their own. They like to do a big one, and then that's it. So, but stop getting them into that routine that until you put something in their anus, they won't put, because you now set up another challenge for yourself that then the baby will never put again until it's waiting until you for you to do what we call an enema for them. So just stop. Don't worry. Let baby poo whenever she wants to poo, and that's fine. And there's no need to worry about it. Okay, last question. Pap Tom Brown weights. Okay. That's the person telling me that your baby is not gaining weight, I guess. Yeah, okay. I cannot know why your baby is not gaining weight, because all you are giving this baby is carbohydrates. Pap, some brown, wheat, banku, rice, yam. No protein. The protein is the bodybuilding food. I can't see any beans. I can't see any egg. I can't see any akara. I can't see any what else? Fish, chicken, blah blah. We can see all those things in this food. So this is too much carbohydrate. So what you need to do, I like your honesty, cut down on the carbohydrates, add more protein to this food, add veggies to this food, okay? Add a little bit of oil as well, okay? So you would need to go to our group, our guide section. You need to look at, we talk about the food classes, we talk about how to mix the food, you need to add other things. So this baby is taking too much of only carbohydrates. We can't see a lot of protein. We can't see the fruits. We can't see the veggies. So you need to add all these ones to the food. All right. So that is what you need to do. Make sure there's a baby should eat a lot of beans. Yeah, you can make it as beans. You can cook it as moi moi. You can make it as a kara. Baby should have at least one boiled egg a day. All right. At least you can start with that. One boiled egg a day. People can take that as a snack in between, or you can put it inside the pap or whatever. At least one egg a day. Give at least one bean or beans made, kind of food, based food. You can make your rice with your beans, for example. You can do your pap with a akara or pap with moi moi, for example. So those are the ways to mix it. Your crayfish, you should be adding it. Your Titus fish, all those things. Those are things baby should eat. Baby should eat more meat and chicken and egg and all those things than the father and the mother in the house. They are not growing. You are not growing anymore. It is the children that need all those protein in the food. All right. And then, so if you go to our Facebook, to the guide section, you will see all the different food classes. We have what we call the food plates. Each time you make a baby's food, there must be at least 4 out of those food classes on the plates. There must be the carbohydrate section, there must be the protein section, there must be the fruits and veggies section, there must be dairy and all that. You need to make sure that anytime you're making your baby's food, you are conscious and thinking, where's the carbohydrates, where's the protein, where's the fruits and veggies, where's the dairy, where's the fat and oil. You must be thinking of it. At least 4 of those food classes must be in the plate at every point in time. So that is eating well. All right. So what your baby have been doing is eating, but your baby has not been eating the well part of it. So happy you will do the right thing now. You know what to do. All right. Okay. You say you give fish, vegetables, and all that. Okay. Yeah, you need to increase the quantity of those ones because you didn't tell us in the first line. So obviously they are afterthoughts. So you need to make sure you had more of them than just the carbohydrates as well. All right, well done. Somebody is asking, my baby is 2 years. How do you stop him from breastfeeding? We have a article on tips for winning. I would recommend you read that because this time is not on our side, and but you gradually stop. You reduce and reduce until you stop. That is a summary. It's not a big deal, but you can't just stop suddenly, which some people do, but I think the best option is to reduce it. So if you are doing 3 times a day, you can do 2 times a day, then you do once a day, then you begin to, then one night you decide that today is the night, and then you just stop. Of course, the child is going to cry and all that, but they will get over it after 2 days. Make sure you wear Fambra, take paracetamol, take painkillers, you'll be fine. All right, last question. Good evening for this wonderful education. My son is 6 years old, just lost the 2 milk teeth. All his mates that I know have lost all the upper teeth. Is this something I should worry? No, it doesn't matter. Whether up or down, they are all going to replace all the teeth anyway. So it doesn't have to be up or down. It can be any of them. It doesn't need to worry at all, at all, at all. And the new ones are going to grow back. So don't worry about it. All right. Somebody say my baby cry anytime I put him to sleep. Don't put baby to sleep. Don't force them to sleep. Baby is not yet ready. When baby is ready, baby will try to sit by himself. And so don't force the child to sit when the child is not ready. So stop giving the child unnecessary pain. All right. All right, we're done. Let's just finish with Instagram and then we go home. Okay, I think I've answered geographic tongue. Somebody saying, Kelly Sika, good evening, ma. My son now 3 years has this wound on his tongue, which started when he was 8 months old. Are you the one that asked about the geographical tongue? Okay, if you are the one that asked about geographical tongue, geographical tongue is not a wound, okay? It's not a wound. It's just like like a map is drawn on your baby's tongue. It doesn't cause pain. It doesn't. Child is otherwise well, but there's like a map-like structure on the tongue. So please be sure it is geographical tongue. So I recommend that you let us see it first, and then we can advise you. But if it's geographical tongue, you don't need to do anything. If it's a wound, because you use the word wound, so I'm going by your own description now. If it's a wound, you need to see a doctor, because geographical tongue doesn't look like a wound. It is just like a map-shaped structure on the tongue. That's the best way I can describe it. Doctor say I'm no more lactating. Shifa girl, if you're no longer lactating, then sorry, you've weaned the child. There's nothing we can do again. You can start to put the child to breast and see whether the baby will suck and whether the milk will flow. Sometimes you can still get it to flow, but if it doesn't flow, buy age appropriate formula, and because you'll be sending milk, you'll be sending milk for the first 5 years of life. So if you're not breastfeeding, you need to be giving age appropriate formula. So, but next time when you have the next baby, make sure you don't reduce the breastfeeding. All right. Someone say you're doing a good job. Please do you have a mobile number? I think it's I wrote it somewhere on this WhatsApp. I mean on this Instagram. If you look at the beginning part of the Instagram, I'm sure you should say that. All right. But the our mobile number is if you want to book a consultation with us. Otherwise, if you have any questions, please go to our Facebook group and you can put your questions there after the program. All right. Okay. I think I'm done. Finally, answer every question. Thank you so much for watching. Thank you so much for joining me this evening. If you have any questions, we have 4 fantastic groups where you can post your questions. Ask the Pediatricians is our main group. You can't miss us on Facebook, okay? If you go to Facebook, type Ask the Pediatricians, you are going to see our group as number 1 that will come up with over 700,000 parents and caregivers of children. So we are big on Facebook. So you can always post your questions on our Facebook from Mondays to Saturday. A lot of people send me questions on Sunday, despite the fact that we've told you that we won't take questions on Sunday and our group is closed on Sunday. People always ask me, oh, I can't post on the group. I can't, and I'm like, today is Sunday. Yes, we can't post on the group. Please, you can only post from Mondays to Saturdays. 24 hours daily on those days, but none on Sunday. And we will try our best to answer your question. We try to say 72 hours, but most time we do your question in less than 24 hours. But because sometimes some questions require real professionals to come before, some questions are FAQ, even our moderators, even our members can answer it, but our moderators will do justice to that. But there are some questions that needs a pediatrician proper, so those ones may take a little bit of a while before we answer them. So if something is an emergency, don't put it in our group. Any emergency, the child is dying, you have to go to the hospital. That is what the emergency means. It is, we have to answer you in 1 minute, we have to answer you in 1 hour, you have to go to the hospital. But if you want to know something else educative, related, not urgent, not that your child is sick or anything, of course, feel free to post it on our Facebook group and we will try and answer you within 24 hours, max 72 hours. Of course, if you want to learn, we have a lot of resources for learning. You can learn on our Facebook groups as well. We have guide session, very lovely. We have our website, www.askthepediatricians.com. You can read all articles about teething, breastfeeding, immunization, developmental milestones. You can read all those articles on our website, or you can follow us on our Instagram page. We always put tips, feeding tips, health tips. We put one at least once a day. You can also follow us on our TikTok. You can also follow, if you want to watch all our past videos, including this one, you can also watch on our ATP TV channel on YouTube. So we have lots of platforms for you to learn, and our goal is so that we can empower you to take good care of our children for us, so that our children will live and not die. On Thursdays, I do take ATP Hour on Fresh Waves Radio, on all our platforms as well. That is not a question and answer session. That's a teaching section where I actually teach on a particular topic. Last week, I talked about female genital mutilation. A couple of weeks ago, I talked about growth in children and how to know whether your child is growing well. So this week, I'm going to talk about epilepsy. So look out for that. And if you want to know more about epilepsy, make sure you join us on Thursday. And all these programs are always available. Even if you don't join us live, you can watch them again at your own convenience. So thank you so much for joining me today. If you have any questions, please go to our Facebook group. If you have something admin you want to advertise or you want to sponsor any of these programs, please email us at askthepediatricians@gmail.com or contact us on our WhatsApp number. It's showing behind my back for those on YouTube and Facebook, and I've written it for those on Instagram. Thank you so much, everyone. I'll see you again on Thursday and next week, Monday. Bye from me. Bye, everyone. Have a wonderful week. Bye.